Why are so many Americans dying of COVID? That is the question I'm going to answer in this video. If you don't know me, I'm Dr. Buck Parker. I'm a board certified general surgeon. I practice in Salt Lake City, Utah. I've been a surgeon for 10 years and started my residency in 2004. So I've been around the block. I've seen some shit, and this is going to be my understanding of what is going on right now. So our hospital, has our own numbers, and we just had a meeting the other day to talk about our numbers, and I started thinking about those numbers and how they relate to the rest of the country, the rest of the world, why Americans have maybe higher death than the rest of the world, and why that would be, and what we did wrong, and who's to blame. Just kidding, nobody's really to blame. Well, I think there are actually some maybe entities to blame, and we'll talk about that. So first I want to tell you a little bit about the patients that I see in my daily practice. And I'm at a level 2 trauma center. We have a lot of elderly patients that have traumatic injuries, and those traumatic injuries are things such as falling out of bed or falling out of their wheelchair and sustaining a broken hip or a intracranial hemorrhage or something like that from very, very minor injuries. And it's going to relate to COVID, I swear, but when these people come in and they say they fell out of bed, like you and I, if I fell out of bed, I probably wouldn't be going to taking a trip to the hospital. But a lot of elderly patients have to do that because they're extremely fragile. Okay, and in trauma, actually, we have a fragility index, and we look at the muscle mass in their psoas muscle, and one of the muscles kind of surrounds the spine-ish. And we can tell by the mass in that muscle, how big that muscle is, if they are fragile or how fragile they are. So I was thinking about this, and I was thinking about our population in the United States and the populations in different countries. And I recently went to Japan, and if you travel the world, it's a little bit striking that Americans are a bit different, and Americans are much bigger than everybody else. And so when we got these numbers, I was looking at them, and it showed that a large percentage, and this is actually true throughout the country, it's not just our hospital. So I started looking this up and did a little research on, and I've talked to a lot of other doctors that are my friends that are across the country, and what they're seeing and who they're treating with COVID and how bad they are and all that stuff. And so I came to the conclusion that, I came to the conclusion from doing a lot of research and other people's research, that Americans get a lot of COVID and get very sick with COVID when they're obese or overweight. And so these patients have a lot more difficult time with COVID than a patient that has a normal BMI from 18 to 25. So if you're over 30 a BMI, you have I can't remember the percentage, but a much higher increase in morbidity, mortality with COVID. And that's because if you got a lot of weight on your chest, you can't breathe to begin with. And your diaphragm is a muscle that helps you breathe. And if you have a lot of weight on it, it's difficult to breathe. And so COVID is a respiratory illness, which makes it also difficult for you to breathe. And so these patients have a really difficult time breathing. And one of the other issues is that something that helps COVID patients is when you prone them or you put them face down on a ventilator. And obese patients have a really difficult time with that. So I'm thinking about this fragility index and elderly patients and obesity and COVID and our death rates and who's at fault and all that stuff. And what I'm thinking is that almost like obese patients are more fragile, right? Like we don't necessarily think of them as more fragile. They don't look more fragile. They look more sturdy, but they're actually not as fragile. When we have a obese patient or a morbidly obese patient get sick, like with a bad infection for like sepsis, they crash and burn so fast because they don't have a very good circulatory system either. So what I'm saying is that the United States has a lot more obesity. We have, I believe, 66% of people in the United States are overweight. We can classify them. 33% obese, and like 15-ish, I think, are morbidly obese. And there's even a population that's like what we call super morbidly obese that are even bigger. That is a small percentage. So when you go to Japan, when I went to Japan, I didn't see that, and I was shocked. Wow, everybody is much smaller here. There's not a lot of obese people. There's like hardly any. And maybe that has something to do with it. I'm pretty sure it does. So then the question's like, who's to blame? And I used to think that overweight people were just, lazy, and they didn't want to eat a salad and stuff like that. But as I have been in medicine for a while and understand society more, I realize that it's very difficult to not be obese in this country because we have companies like Pepsi Cola or Coca-Cola or whatever, Pepsi, making things like Diet Mountain Dew, McDonald's, Burger King. I mean, all these things that are super cheap, that are very tasty, and they need to make their stockholders happy. So they gotta sell more stuff, and there's a lot of really smart people marketing for these companies. Once you get kind of like hooked into that, your brain really gets on this kind of cycle of, you need that stuff and all that. So it's really, really difficult to pull away. And that's what I see. So I think it comes down to that obese patients are really fragile when it comes to COVID. That is the main issue. I want to clarify, we're talking about patients that are like less than 55-ish, because over 55, those elderly patients are already just fragile by themselves. And I know over 55 is not really elderly, but classified as in medicine, that's what we say, 55. So when we're seeing all these deaths, number one, most of them, large majority of them, are very old, elderly, very fragile patients. Number two, if you see one that's like, oh boy, this guy was 40 years old and he died of COVID, that's terrible. Many of those patients, most of those patients are obese or overweight, or I want to say obese, actually, not even overweight, obese or morbidly obese. And so if you take all those patients away, you don't have a lot of deaths from COVID at all. And other countries are not as old as we are. We hold on to our elderly people, or relatives, until like they barely can do anything. Like they're just sitting in a nursing home for 15 years sometimes, and that person doesn't have any reserve. If they get a hangnail, they die. Like if they fall out of bed, think about that. If they fall out of bed, some of these patients don't live 20 days. So they're extremely fragile. I just don't think the rest of the world holds on to elderly relatives as long as we do. I'm not judging. I am judging. I don't think we should do that, because I talk to a lot of them and they all think that they're living too long, but the families don't want to let go of them. It's a whole nother, that's another video. So there's a morbidly obese patient right there in the car. We are much bigger than the rest of the world, and we're much older and much more fragile. And I think if you put those things together, you will find that is the source of our horrific death rate in our country. So if you want to blame somebody, I would blame Coca-Cola, Warren Buffett, because he likes Coca-Cola, and McDonald's, and he promotes it, and all that bad food and nutrition. It's horrendous, and that is another topic for another day. But that is my COVID update and how I view it right now. Could change, I don't know. I'm sure somebody's going to tell me I'm very wrong, which is okay. I hear that a lot. But I have a YouTube channel and you don't, so. Alright, you guys, hey, thank you so much for watching this video. I think I might do more news, health news. What do you guys think about that? Comment below if you want to hear more health news. Not necessarily COVID, just like health stuff. The things I see, what I think about them, all that. Yeah, you guys have a good day. Subscribe, like, share, all that good stuff. I will see you in the next video.